And speaking of safe staffing ratios, our Eric Nackton catches up with state lawmakers on their plans this legislative session to ensure hospitals are up to staff to care for patients.
Pursuing the best possible care for patients has new momentum this year in Hawaii. A bill was introduced Thursday into the state legislature to create safer nurse-to-patient ratios, enhancing quality care. All of the major nurses' unions in Hawaii have reportedly banded together in favor of the bill.
The fact that, I'm able to stand here with two other nursing unions from Hawaii is incredible. It's probably the first time you ever see that.
A recent CDC report involving 2,600 doctors, pediatricians, physician's assistants, and nurses resulted in concerning mental health results.
26% of our participants reported mental health symptoms severe enough to meet criteria for a mental health diagnosis. It's important for us as a society to think about kind of the social environment in which these is contributing to the development of these mental health issues.
600 nurses at Kapiolani tell me we're fighting for ratios. I've listened to almost 1,900 nurses at Queens. Now I'm listening to 140 nurses at Wilcox, who is alone in Kauai, fighting for the ratio. So please understand, this is important.
What sort of nurse-to-patient ratio are you looking for?
It's not one ratio, like just in general, that applies to all. It would be based by the units. So if you're a med-surgical unit, you'd have 1 to 5. If you were telemetry or a step down, you would have a 1 to 4. Every patient that walks into a hospital would get the same type of standard of care. This would allow a minimum core every hospital of being able to have that minimum.
The nurse-to-patient ratio bill will be debated in the legislature this year and voted on this session. Eric Nackton, Island News.